the initial sort of impetus for doing this study was really in my day-to-day taking care of patients who stop their antidepressants for a variety of reasons in pregnancy. And then unfortunately, we see that they really suffer in terms of their mental health during pregnancy and postpartum. And so this was something that I was seeing in my practice, and as an maternal fetal medicine fellow who takes care of these patients, was really interested to kind of study this phenomenon. So I was lucky enough to partner with Independence Blue Cross in Pennsylvania to be able to really use the database to be able to assess, what are the patterns in antidepressant discontinuation, who is discontinuing, when is it happening, and does it impact outcomes for patients, specifically in terms of mental health emergencies for patients. So this study was looking at sort of recent data from 2023 to 2024, and we were able to pull all of the deliveries that happened in the Independence Blue Cross Pennsylvania database and look at patients who had a pre-existing diagnosis of depression and anxiety and were on an antidepressant prior to pregnancy. And we were interested in sort of looking forward to see what happened in pregnancy. And one of sort of our big findings was that discontinuation was really common. And that's something that we had previously seen. One of my co-authors, Sarah Cornfield, had done kind of similar work in a Medicaid population, which is now older. It came from 2007 to 2009, and also saw high rates of discontinuation. And that's similarly a similar finding to what we saw in our study. But I think what was so surprising is how high discontinuation was. So in this patient population, only about 17% of patients continued their treatment uninterrupted throughout the pregnancy. So really high number of discontinuation was happening. The thing that I think was really surprising was the magnitude of the effect that we saw in terms of mental health emergencies for patients. So we saw that especially in the beginning of pregnancy and towards the end of pregnancy, there was a much higher rate of patients presenting for a mental health emergency to an emergency room. And that was particularly much higher among patients who stopped their antidepressants in pregnancy. And in this database, we saw it was more than 500 emergency room visits, more for patients who stopped compared to those who continued their antidepressants in pregnancy. And I think this is, really significant in terms of thinking about the risks of stopping antidepressants in pregnancy. And something I'm hoping to, use kind of in my next phase of research and in practice. I think that those are all really, good points. And I think that, we think about the first and the third trimester as being particularly vulnerable for patients. And I think that that's true of patients in general, especially patients who have underlying depression and anxiety. In the first trimester, like you said, pregnancy recognition brings its own stress, the stress of sort of having any symptoms in the first trimester, whether it's nausea or bleeding, that can be really challenging for patients. And then again, in the third trimester, patients are planning for delivery, starting to think about their life after delivery, and that can sort of bring its own set of stressors. And then especially, I think the thing that's interesting is that it really also aligns with when discontinuation of antidepressants is happening. We saw that the majority of antidepressant discontinuation happened in the first trimester, where you also see that peak in emergency room visits for a behavioral health indication. And then similarly, again, in the third trimester, we saw a peak, which corresponds to that same discontinuation of antidepressants that's highest in the first and then also the third trimester of pregnancy. So I do think that is a possible explanation. It's the discontinuation of antidepressants in addition to the stressors that those point in pregnancy bring for patients.